What's going on, everyone? Hopefully, everyone's staying safe, healthy. Hopefully, if you had to take a COVID test, you tested negative, or maybe you didn't have to take one at all. It is time for my weekly piece where I share with you just what is bothering me this week. And this week, it's a good one. All these comments that I see on Twitter, uh, Facebook, articles. Yes, I did say Facebook because I still see once in a while, I'll see a news story shared from a news agency about coronavirus, and I see all the haha likes come up, all the angry likes come up, sad, all the different likes, but basically the troll comments that I'm seeing on these postings, especially Twitter. And I see people say, oh, I'm not going to continue wearing a mask just to save grandma. COVID's just a cold. It's not that bad. No, you can't get it that bad. It's only seniors that get it bad. It's only old folks. Kids don't get bad. And the one that got me the most, there's nothing wrong with my child. My child is not sick. I mean, it goes on and on. Well, I'm going to prove to you in this video, this is going to be only a 10-minute video. It's not going to be as long as our pandemic update. I'm going to prove to you in this video that no, all ages can either get COVID bad, have long COVID, or yes, sadly, any age can die of COVID. So just give me 10 minutes of your time, and I'll prove to you that any age can get COVID bad. Alright, first off, we shared this in the pandemic update today. I thought my 19-year-old daughter had long COVID. It turned out to be dementia. Well, it turns out this person had coronavirus back in 2020. They had a rather severe case of it. Remember, this was before the vaccine existed. And then they ended up getting post-COVID effects. And as we know, more on this in a minute, COVID can affect the brain. Well, guess what? She thought her brain fog was a symptom of long COVID. Turns out she's diagnosed with dementia. That was back at 19 years old. She's now 20 years old. 20 years old. Look at this person. This is so sad. Someone at 20 years old getting dementia. Why? Because they had a COVID infection. Let's move on here. Study. There's a lot of studies that I can show you. I can show you many studies. This one says, study. Parts of COVID-19 may stay in the brain long after an infection. So the virus itself can live in your brain and cause God knows how many problems. It can reduce the oxygen level. I got a study for that I could show you. And it's bad. When COVID persists in your brain, it can do an endless number of things, such as, going back to this, causing dementia or Alzheimer's at a really young age. Any age can get it, thanks to COVID. All right, moving on. Prior to COVID, it was rare to get dementia and Alzheimer's in younger ages. It did happen, but it wasn't very often. Usually it was, as you get older, but thanks to coronavirus, it's now any age. All right, let's take a look at deaths here. All deaths involving COVID-19. Well, let's see. 0 to 17 years old. 1,622. But wait, they said only the old folks are bad. No. Look how many. 1,622 have died at a young age. 18 to 29 years old. 6,943. 30 to 39 years old. That's just not a senior citizen. 19,699. 40 to 49 years old. 45,957. 50 to 64 years old. Now you're in the middle age, but you're not quite at a senior citizen yet. And 201,612 people. Now we get a little older. 65 to 74 years old, and that's at 254,117. And a quick disclaimer, I forgot to mention this, this is just in the United States. There have been COVID deaths all around the world at all ages. And yes, then you get to 75 to 84 years old, and of course, yes, the number does go higher. 85 years old, yes, over 300,000. But it doesn't stop there. I continue to show you this. A new study is now showing that COVID is the leading cause of death in children. This is not good news at all, and further shows that letting the pandemic rip is not such a good idea. And that leads us up to this. Protect your child from COVID-19, the flu, and other illnesses. What you need to know. During the school year, kids tend to get sick more often and spread germs into their friends and classmates. COVID-19 can cause serious health problems, so it's more important than ever to protect your child's health, such as wearing a mask. And everyone associates masks with COVID. Newsflash, I want to show you something. Let's go back to this. Let's go back to our lovely deaths here, which it's not so lovely. It's sad to see. Deaths involving pneumonia in kids, 2,611. Deaths involving COVID-19 and pneumonia. In other words, they had a double infection, 408. Deaths involving influenza. Oh, hello. Yes, 0 to 17 years old can die of influenza. 475 kids. These are all airborne viruses, all viruses that can be prevented by wearing a proper N95 mask. And let's just go up to 40 to 49 years old. Yeah, look at this. The deaths involving pneumonia, 39,411. COVID-19 and pneumonia, 23,973. It's happening in 30 to 39 years old, 18 to 29 years old. The point is, these are all ages that are not senior citizens. Let's continue on here. Here's another study. Study shows prevalence of long COVID in a university community. So now let's talk about long COVID. You didn't die from the infection. You're not a senior citizen, but you never recovered from your infection. Yes, that's something real that is happening. A study published today suggests the prevalence of long COVID was 36% among George Washington University students, faculty, staff, and other members of the campus community who had tested positive for COVID-19 between July 2021 and March 2022. We're now in May of 2023. Who knows? That could have been higher. Yes, some of them might have graduated, but maybe more have tested positive. Don't know. So this number could be higher since this time. Let's move on to this. Oh, but again, it's just senior citizens. Oh, I don't want to wear a mask to protect grandma. Oh, really? 65 million people around the world are said to have long COVID, and that is an undercount because many countries don't even count how many long COVID cases there are in this world. That's right, I repeat that again. More than 65 million people around the world may have long COVID. That's a heck of a lot of people. And are you still not convinced you don't want to wear a mask? Okay, I'll continue this. Let's go to my website. Folks may know I have a website called datareport.info. I archive COVID information. I archive information on influenza, H5N1, avian flu, monkeypox, tick-related illnesses, chronic wasting disease, celebrity information, on and on we go. I document a lot of viruses, and I have other people that are starting to chime in, and they're documenting things. The point is being proven. I have, since I started my website, have added 95 topics in COVID studies and papers. And mind you, I missed a lot that were not released before the website came out. I missed some in between. As of lately, I've been slow to add some. I'm going to keep adding to this. Who knows how big this is going to get? It'll probably eventually go into the thousands at some point. Let's just take a look at a few of them. Study finds significant amount of clotting in the arteries of patients with STEMI and COVID-19. Oh, someone who had COVID-19 could have blood clots. Verified COVID-19 infection increases diabetes risk. Oh, but they said it's just older people. No, this is happening at all ages. Long-term adverse effects of mild COVID-19 disease on arterial stiffness. Let's just go down to some random ones. Oh, here we go. COVID can be passed from pregnant mother to fetus. So if someone who's pregnant gets COVID, they could pass it on to the newborn child before the child's even born, and they're born with a birth defect or a problem at birth. And it goes on here. There's 5 pages here. Here we go. Here's a really good one. Study links long COVID with lower oxygen levels in the brain. Well, we know if there's lower oxygen levels in the brain, guess what happens? You can develop dementia and Alzheimer's at a young age, going back to where we started here. Unfortunately, this child, this teenager, now 20 years old, did just that. Are you convinced now? COVID affects people of all ages and can affect all ages seriously. It's not just grandma dying of COVID. So, folks, I ask you this. If you're going to go into a public place, a grocery store, maybe you're going to go out and see a movie, and especially in a healthcare setting, please mask up. The risk of COVID is real, and it's real for people of all ages, especially your children. Think of the future of your children. Do you want your children to have a healthy life in their future? Then mask up. Send your kids to school in a mask. I don't care what you may think of me for saying this. Guess what? It's the right thing to do. And right now, COVID cases are significantly undercounted because we don't know how many cases there are right now. The risk is real. So please, all I ask is continue to mask, continue to stay safe, stop with these ridiculous comments, and take it seriously. Thanks for watching this video. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Have a great afternoon, everyone, and until I see you again next time, stay safe.